We're going to now take up House File 1531. Chair Lee is here to present the bill, and he is going to I'm going to move on his behalf that House File 1531 be laid over for possible inclusion in the finance bill. Welcome, Chair Lee. Please go ahead.
Thank you, Madam Chair and committee members, for the opportunity to present House File 1531. This bill will create a pilot program to address trauma and underlying cause and result of gun violence. Gun violence takes different form in different parts of our state, but often results from the same cause, which is trauma. Research has shown that perpetrators of gun violence are often victims of gun violence themselves or have experienced forms of gun-related trauma. This bill creates a pilot program to address gun violence-related trauma by providing training, resources, education, and education to individuals, organizations, and the wider community. Just a summary of the bill. The bill directs the Commissioner of Health to establish this pilot program to aid in the reduction of trauma resulting from gun violence and to address the root causes of gun violence. The pilot program will make resources available to professionals and organizations who work with victims, witnesses, or perpetrators of gun violence occurring in a community, domestic, or other settings. These resources include training and recognizing trauma as both a cause and effect of gun violence, skill development for practitioners, and investment in community-based organizations that provide these services, replication and expansions of successful community-based violence prevention initiatives. And the pilot program will address the traumatic effects of gun violence exposure holistically, and materials are required to be prepared in multiple languages for those that speak English as a second language. Advisory panel will be formed to develop the protocol and programs for the guidelines that I am proposing, and a report is required for the pilot program to the Committee of Health and Public Safety, and we're proposing $100,000 in fiscal year 2022 from the general fund for this purpose. And members, really, this is an issue that I wanted to bring forth because of some of the violence gun violence that I have seen in my community, and you're just engaging with my community members and talking about how, even though we're not directly victims of gun violence, just having to go through that or see some of these scenes or whatnot in our community really is traumatizing. And having conversation with neighbors, in the back of the alley of my house, and just bringing up this conversation of, are you getting help? And even talking to all of you today, I am getting goosebumps, and it's making me stress out and have a little bit of anxiety. And so I just want to let you all know that this is something that is serious and that we should consider having the Department of Health take a look at this. And I thank you, Chair, for the opportunity to present this, and I'll now move over to my testifiers.
Thank you very much, Chair Lee. We appreciate it. Iolanda Evans-Mack, welcome. Please introduce yourself and go ahead.
Thank you, Madam Chair, Representative Lee, and committee members. My name is Iolanda Evans-Mack. I'm the Director of Community Response and Education for Protect Minnesota, and also the co-founder of Black Family Blueprint. Gun violence, as we know, is a public health issue. And so the establishment of this bill, a trauma-informed gun violence prevention pilot program, will help meet the community needs, especially the communities within the Twin Cities who are most frequently exposed to gun violence. It will also help prevent further gun violence by addressing the impact on those who have survived it. Trauma is both a cause and an effect of gun violence, and research shows that early and direct exposure to violence is the best predictor of whether an individual would later engage in gun-related crimes. Gun violence is a multifaceted challenge. It demands a holistic set of solutions to stop the cycles of daily gun violence in under-resourced communities. One of those being adequately and sustainably funding community-based, trauma-informed, and healing-centered violence prevention efforts, which will build authentic relationships with communities, address those root causes, support community-based organizations, and then also build on the skill development of professionals and practitioners in the field that they may lead with holistic and trauma-informed lens. I'm a homeowner in North Minneapolis, Minneapolis. I live here with my husband and 2 young children. And I tell you, it really breaks my heart to see the fear in my children when we hear the familiar pop, pop, pop in our community, the questioning if it was fireworks or if it was gunshots, and to see the mounting trauma inside of my children's young brains and wondering if I can save them from either end of the gun. But the issue of gun violence is not a Minneapolis problem. It's not a St. Paul problem. It truly is a problem in the state of Minnesota. This is a broad Minnesota problem that we're mentioning. And so we have to talk about the resources and action that's required to reduce gun violence in our communities. And just to mention, studies have found that harsh penalties for gun crimes, they have no deterrent effect and they do not decrease firearm crime. Minnesota needs new solutions to prevent gun violence. And so this bill is, in my professional opinion, a step in the right direction for individuals, families, and communities living within the state of Minnesota. Thank you.
Thank you so much, Ms. Evans-Mack. You are so correct. This is not just a Minneapolis and St. Paul problem. We just saw this in Buffalo, Minnesota. And of course, we've seen it elsewhere as well. So thank you so much. Next testifier, Roxanne O'Brien. Welcome to the committee. Please introduce yourself and go ahead.
Hi, everybody. My name is Roxanne O'Brien, and like Fuli, I'm feeling a lot right now because I want to say facts. I want to tell you personal stories, and I know I only have like 2 minutes. But I did want to just bring, since this conversation also followed a really important conversation around mental health, I did just want to add that I had found an article that last year's theme for Mental Health Month was greater investment and greater access. And something relevant to add that I think is relevant to gun violence is the pandemic. Out of the article, the pandemic and the issuing uncertainty and economic instability have not only led to a spike in the number of mental health cases across the country, but also have exposed the inadequacy of our healthcare system's crisis readiness in tackling a surge in mental health cases. If we do not address the problem now, we are looking at a mental health epidemic down the road, one we are woefully under-equipped to fight unless there's an investment push in government-backed awareness programs to destigmatize mental health problems. People are not going to come out and talk about it out in the open. One factor is that the mental health problems, we cannot expect to make headway in spreading awareness about mental health problems when the budgetary allocation for mental health is just 0.05% of the total healthcare budget. In a country with a population over 12 million, and then with just one psychiatrist for over 13,000 people. Most mental health professionals shoulder an excess caseload without any institutional support. So as we think about investment with beds, we also have to think about adding more mental health professionals.
Well, thank you, Ms. O'Brien. I have to ask you to wrap up, but you've been addressing something that really isn't this bill. Did you want to say something in addition about this bill in particular?
Well, I would like to say that it is relevant because mental health issues are impacted by violence. And I live in North Minneapolis, and sometimes violence is, it's in many ways. So when you have when you have policy that's also violent, you also have people who are so stressed out that we end up taking it out on each other. So I would like to say that my son, my personal story is that last year, right after his 17th birthday, or right a week before his 17th birthday, he went into psychosis from just a lot of the stress in the neighborhood, from being around friends who are affiliated, and friends who are, they feel the violence and the trauma from officers, from gun violence from them. and they feel the violence and the trauma from gun violence just happening too often. And I want to say that what my son went through was really hard. You may not look at a taser like a gun, but it's shaped like a gun. And when he went to the hospital for mental health support, he was tased in his back twice, and he wasn't a violent kid. So some people may think it's not connected, and I know you want me to stay on topic, but I will say that it is connected. And I will say that every other night we're hearing gunshots. And it's hard as an organizer and as an activist. It's hard to sit here and talk to you about policy when this is our lives.
Yeah. All right. Well, thank you so much, Ms. O'Brien. We really do appreciate you being here and being part of the conversation. Representative Ryer has a question or comment. Representative Ryer.
Thank you, Madam Chair. Thank you, Chair Lee, for bringing this bill forward. I want to speak on behalf of it as a strong supporter of it, and I'll just tell you a little why. I mean, to me, I look at the way forward is for us to really understand root causes. And when Ms. Evans-Mack spoke about trauma as a root cause, that resonates with me. The trauma from gun violence affects people's health. The stress of trauma leads to chronic health conditions. It leads to inability to perform in school. I mean, who in this room could learn when you've been living through the type of gun trauma that has been described so eloquently here today? And so because we are looking for ways to get at the root of issues, to me, this is just the smallest possible investment in something that is deeply, deeply important. And I thank you again for bringing it forward.
All right. Thank you very much. And I just want to check, Chair Lee, there was no amendment for this bill, was there?
No, Madam Chair, we don't have any amendment for this bill.
Okay, just checking. All right. Well, Chair Lee, do you want to have the final word here and before we lay the bill over?
Thank you, Madam Chair and committee members for having discussions. And I just want to say thank you to both Ms. Evans and Ms. O'Brien for, talking about their experience in this work around this. And just ask members to consider, when you come up with the health budget, the impact that this is going to have or is already having on our community, some of the most vulnerable communities out there that we at the legislature try to help out every single day. And Madam Chair, just want to say I'm thankful for this opportunity and look forward to this ongoing conversation.
Thank you so much, Chair Lee, for bringing this. And to our two testifiers, really deeply appreciate it. I must say I have chills too. And I bet that many of our members do. This has really been very moving and impactful hearing on a bill. So thank you very much for bringing this to us. And with that, House File 531 is laid over for possible inclusion in the finance bill. Thank you.